Okay, so these areas with the L-therapy comfort treatment that I've developed here at the Maas Clinic, we're able to get complete blocks with very tiny little shots of numbing medicine, and I've kind of highlighted the key nerves. The infraorbital will do a little block there that gets all of the mid-face and cheek region here. The area of the mental nerve gets the entire lower lip region, so we can get all around the perioral region. And the key in the neck here is this Erb's point. There's a block that I can do in the back part of the neck. This is right in the back part of the big muscle of the neck, and that's where all these little sensory nerves come out that supply the sensation to the neck and the jawline. And by blocking that point and along the back edge, which is the big muscle I said in the neck, just tiny little subcutaneous injections makes that all numb. And then I'll hit this one called the auriculotemporal just with a couple little shots. And there's actually one up here called the lacrimal. And getting those blocks makes the whole brow and lower face completely numb, and people can have a completely comfortable treatment. The lower face, and those little shots sting a little bit, but then the whole thing's done. You don't feel anything else. The biggest issue historically, although a lot of people honestly don't even feel L-therapy at all. You know, I've had it and I felt it. There were a couple of hot spots, but it was totally tolerable. I mean, it was. But for slender women like you, I think a lot of slender women have more discomfort. So, you know, offering a block or some numbing depends on your pain sensitivity or threshold. Or you generally, do you think, have a high pain threshold or low? In between?
I think in between.
In between, okay. So for really anybody, what we can do is just hit some areas that are very specific that will make the whole area numb that we're treating. And I can do whole areas so that your neck is entirely numb, the lower face. In your case, we're doing just the upper face, some areas where the upper face area is numb. It's pretty simple to do that. And these relate specifically to the neural anatomy that's right here. If you want to take a look, I'll show you this. There's two main nerves, the mental nerve, which we've talked about before. It comes out for the lower face. This isn't for her, but it comes out at the first molar, and it's below the teeth, and it's almost always at the mid-pupillary line. And then if we go at the middle of the face, there's the infraorbital nerve represented right here. And you can almost feel that on yourself or on anyone. There's a little foramen or hole where it comes out. I can feel hers right there. And if I block that, you can see the nerve distribution coming out here. It gets the entire area of the lower lip, middle part of the nose, and the lower eyelid. You see the little branches coming up here. For the upper lid, there's two middle nerves here, the supratrochlear and supraorbital. And only some of these branches when we're doing brow lifting, because when we do L-therapy brow lifting, we're trying to pick, what I do is pick the best vector of lifting, and I'll mark this with Teresa so you'll see, but I look for what's the best direction that I'd like to, you know, vector for tightening the fascia that I can use, and we'll do a block primarily for this lacrimal nerve, which is right at the tail of the eyebrow. So we'll do a little drop right out here to pick that up. And the only other one that has any effect, this is isn't unlabeled, but is the zygomaticofacial nerve. And then this one coming up here comes up from the side and right along the temple area here. That's the auriculotemporal nerve. That's actually a division of the fifth cranial nerve, the third division though. So these all, in the upper face, they're the first division of the fifth cranial nerve. In the mid face, they're the second division of the fifth cranial nerve. And this is the only one that is the third division. And then so we've drawn these out, and I've written this protocol very carefully for L-therapy comfort treatment. So we don't have to have, you know, you see the big issues with people when you read online about it, is it was uncomfortable. You don't have to have anybody uncomfortable. Do a proper block, people don't feel anything. I'm going over this with you because yesterday we were talking to a person who was having it, and really apparently elsewhere or something, but didn't get a good block. So, and I don't think a lot of people offer it. The main thing in the neck is this point called Erb's point, which is halfway between the origin of the sternocleidomastoid muscle, the big muscle in your neck. Here is this sternocleidomastoid. It inserts at it's got a clavicular and a sternal head, which is what makes the little split here. You know, there's a little split where the two heads divide for this muscle, and this muscle is also where they will often put in IJs, if you've ever been in the ICU, ever done the ICU work, no. So if you put a line in the IJ, that's the spot you do it. But that muscle right at the very back edge of it and about midpoint of the neck, so if I were doing it on her, you can see her sternocleidomastoid here, coming down. About halfway down, right in this area, is a place called Erb's Point. And Erb's Point is where all the sensory nerves from the neck come out. C2, 3 branches, these are all sensory nerves. So if we get a good block along the back edge of the sternocleidomastoid, we get almost all the neck, except some crossing over nerves here, which is why these little dots are along here, where we'll do little drops if we're doing the lower face. So if you're interested in more information on this topic or any of our other topics, please don't hesitate to write at drmaas.com. You can send videos, you can send photographs, or just written text with questions, and I'm happy to answer them. We're more than happy to have you visit our website or visit our Facebook page at facebook.com/Maas Clinic. This is Dr. Corey Maas on Looking Your Best.